topic was whether or not assisted suicide should be legal. To understand this concept, we first have to know what physician-assisted suicide is. Physician-assisted suicide is when a physician administers lethal drugs to a terminally ill patient. It's legal in 10 states, DC, and many countries in Europe and around the world. However, in most places, it is illegal. I believe it should be legal for 3 reasons. 1, ending misery when and where they want to. The top reasons why terminally ill patients want assisted suicide are disease-related symptoms, loss of autonomy, loss of ability to enjoy activities, and fear of future suffering. Skorstengard said, regardless of their diagnosis, most patients wish to be cared for and die at their home. The best medical care is the one that's best for the patient's well-being, so it's important that terminally ill patients should be able to end their lives in the place they are most comfortable. The second reason I believe physician-assisted suicide should be legal is it decreases the number of non-assisted suicides. A doctor not giving terminally ill patients medicine is not going to stop the patient from wanting to end their life. If they truly are adamant about ending their life, they're going to find another way to do it. In the UK, according to a study, terminally ill patients had a suicide rate of 1.72 times the rate of healthy people in their same demographic. Allowing people the option would help avoid the more harm-inflicting act of suicide without physician's assistance. The third reason I feel it would be necessary to have a physician-assisted suicide is that it'd be easier on the family of the terminally ill. According to SWORT, family and friends of cancer patients who died by euthanasia cope better with respect to grief symptoms and post-traumatic stress reactions than the bereaved of comparable cancer patients who died in a natural death. This means people who died from physician-assisted suicide, their families and friends grieved easier than people who died, not suddenly, but just died when the doctor said they might die. Their family had worse of a reaction than the people with euthanasia. This allowing physician-assisted suicide would give terminally ill patients an ease of mind when deciding whether or not they want to take the course of physician-assisted suicide, because they'll know it'll be easier on their family. And while this should not be the main factor, it would be one of their factors in deciding. One opposing argument to this is the slippery slope argument. The slippery slope argument is basically saying that voluntary euthanasia and physician-assisted suicide could lead to non-voluntary and involuntary euthanasia by giving doctors the power to decide when a patient's life is not worth living. Not only do people believe that doctors could make this decision, but they also feel people close to the terminally ill patient can make this decision, like close family members or caretakers. Is this a valid argument? I believe in most ways, no. Physician-assisted suicide and euthanasia are completely different. Physician-assisted suicide is when the physician supplies the drug, but the patient administers it. And if the person is unable to administer the drug themselves, they are not allowed to be prescribed the drug. And there are also many other procedures put into place so that the person who wants to take the lethal drugs to end their life then, they can't just pop up out of the blue with this decision of ending their life. Thank you for your time.